टेंशन मत लो, हाँ बस। अभी नहीं दिख रहा।
जो दिल का हो खूबसूरत, खुदा ऐसे लोग कम बनाए हैं, जिन्हें ऐसा बनाया है आज वो हमारी महफिल में आए हैं। लेडीज एंड जेंटलमैन, let us now proceed with our inauguration ceremony. I extend my heartfelt thanks to Padam Shri awardee Dr. Sonia Nityanand ma'am, Vice Chancellor at KGMU, for graciously accepting our invitation. I would like to ask ma'am to kindly grace the stage with her presence. Thank you, ma'am. I would also like to extend my welcome to Pro Vice Chancellor ma'am, Dr. Abjeet Kaur, our guest of honor, Dr. Vijay Dikshit sir, our Foundation Day orator, Dr. Z.S. Meherwal sir, our special guest, Dr. S.K. Sinha sir, thank you sir. I would also like to extend my welcome to our organizing chairperson, Dr. S.K. Singh sir, professor in Department of CTVS KGMU, professor and head of Department of CTVS, Dr. Vivek Tevarsan sir, and our organizing secretary, Dr. Bhupendra Kumar sir, associate professor in Department of CTVS. Thank you so much, dignitaries. Now, as a mark of our deepest respect and warm welcome, we would like to present floral bouquets to our esteemed dignitaries. May I present a bouquet to our Honorable Vice Chancellor Ma'am as a token of gratitude and respect. Next, may I present a bouquet to our respected Pro VC Ma'am, Dr. Abjeet Kaur, to Dr. Vijay Dikshit sir, to Dr. Z.S. Meherwal sir, to Dr. S.K. Sinha sir, To Dr. S.K. Singh, sir. To Vivek, sir. And to Dr. Bhupendra, sir. Thank you so much, dignitaries. Respected dignitaries, as customary, every auspicious occasion begins with an invocation to divine. So I would like all the dignitaries to kindly come forward and start the ceremony by lighting the lamp. Let, Let us now begin by remembering Ma Saraswati, the eternal source of wisdom and learning, through Saraswati Vandana. For that, I would like to kindly ask my dear staff members to come forward.
या कुन्दें तुषारहारधवला या शुभ्रवस्त्राविता या वीरावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्कर प्रभिदिवि देवै सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारिषार परमा आद्यां जगद्व्यापिनी वीणापुस्तकधारिणीं भययदां जाड्यान्तकारापहं हस्ते स्फटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदां बुद्धिप्रदां शारदां बुद्धिप्रदां शारदां. Thank you everyone.
A big thanks to my amazing team that was truly wonderful. Moving further ahead, I would like to call upon our organizing secretary, Dr. Bhupendra Sir, Associate Professor in Department of CTVS KGMU, to kindly address the audience with his kind words.
Good morning, respected teachers. On behalf of Department of CTVS, it is my distinct honor and immense pleasure to offer you the warmest of welcome to our 66th Foundation Day function, to our esteemed chief guest, our Vice Chancellor, Padam Shri Professor Sonia Nityanand ma'am, Pro VC, Professor Abjit Kaur ma'am. Uh, we are presenting our heartfelt welcome to our respected, esteemed alumni who come all the way from different part of this country and spare some times for us from their busy schedule. We are also presenting our heartfelt welcome to our respected faculty members. We also welcome our dedicated team members and staff who works tirelessly for making this event a grand success. We also welcome our cherished retired employee whose dedication and determination for the department was truly remarkable. Welcome our beloved friend and family and respected teachers. Thank you for joining us today. Thank you.
Thank you so much, sir, for those wonderful words. Now I would like to call upon stage our Professor in Head of Department of CVTS, Dr. Vivek, sir, to kindly present the annual report.
Thank you so much. Respected Vice Chancellor, Honorable Padam Shri Professor Sonia Nityanand ma'am, respected Pro Vice Chancellor, Professor Abjit Kaur ma'am, and our guest of honor, Dr. Vijay Dikshit sir, our esteemed Founders Day orator, Dr. Z.S. Meherwal sir, our special guest, Dr. S.K. Sinha sir, all dignitaries, seniors, alumni, friends from the media, colleagues and friends. It is my humble privilege and honor to present to you our department's annual report for the year 2024 on the occasion of the 66th Foundation Day celebration. Our annual report will be incomplete without the history and the journey of the development of our department. This presentation is dedicated to all our alumni who were part of this department, embodied it in mind and spirit, contributed to the growth and development, and still carry on the legacy of the department to all the corners of the world. So the history starts in 1959, just 6 years after the world's first open heart surgery in the US, when a chest surgery unit in the Department of General Surgery was formed. The first head was Professor A. Charan, who pioneered and institutionalized the practice of thoracic and vascular surgery. He also ordained the chair of the president of the Association of Thoracic and Cardiovascular Surgery of India. Work mainly comprised of thoracic procedures. Many of you must be remembering this old picture of the TCVS building in the old campus and the picture of our old operation theater. This would have been a very familiar sight to most of you as you came to work. Our old picture of the fluoroscopy room. And another old picture, one of the alumni is here with us. At that time, pacemakers were the domain of cardiac surgery. By 1973, our department had an infrastructure which was arguably amongst one of the best at the time in the country. The department had dedicated OT and ICU with ventilators, heart-lung machine, infusion pumps, portable X-rays, fluoroscopy, in-house ABG, and generator backup for round-the-clock electricity supply. A picture of our old ICU. Another picture of a patient getting well-equipped ICU at that time. And with that infrastructure, the department was performing all forms of vascular, thoracic, including all esophageal surgeries, basic open heart surgeries, flexible bronchoscopies, and VATs. A picture showing our alumni and late Professor K.N. Sinha sir and late Professor Shekhar Tandon sir. The team was young, vibrant, and ready to fly higher. Even daughters at that time came to help their parents in the ICU duties. By the end of the 20th century, there were many firsts done by by our department in Uttar Pradesh, like the first pacemaker implantation, the first open heart surgery, the first coronary artery bypass surgery, the first flexible bronchoscopy, single and double heart valve replacements, and the first videoscopic thoracoscopic surgery in UP. This is another old picture of our team at that time. And yet another old picture showing the Bhumi Pujan of the old building. By the 21st century, Professor K.N. Sinha had retired, and seeing the department's progress in cardiac work, he advised Professor S.K. Singh sir to build a new state-of-the-art setup to cater to the ever-increasing demands of cardiac surgical patients coming to KGMC. Moving on, the first beating heart CABG in UP was done by sir in 2002. This is the picture of the very same patient in the ICU. This is the same picture of the patient recovering. Some of the staffs are present with us here. A handsome grant from the government was sanctioned and the old was able to be renovated, as can be seen in this picture. Further, in 2003, the first minimally invasive cardiac surgery, beating heart CABG in UP, was done by sir. Here we can see a newly equipped operation theater and ICU in the old department. Work continued to grow, and with increase in demand for high-end surgeries, the need for a larger and modern cardiac surgery center was envisioned. With the effort of Professor S.K. Singh and the then Vice Chancellor, the government granted permission to make a new state-of-the-art cardiac surgery center. The Department of Cardiology and Psychiatry were kind enough to provide space for the same, and in the premises of this very building, the Heart Surgery Center plan was born. This is an artist's impression of the proposed CVTS building in 2008. Finally, in 2011, our state-of-the-art CTVS building was handed over to us. Professor J.L. Sahani at that time had joined KGMC after retiring from the LPS Institute in Kanpur. It was indeed a pride for KGMU and the apple of the eye for all. This is a picture of our building, an aerial view, another from the front, and these are other views. Standing proud and tall, this infrastructure gave us new horizons to fly, reach higher, and keep abreast with the best centers in the country. Dr. Nitin Rajput was the first MCH candidate to give the exam for this building, from this building. Sir is here with us. Amongst those present here, Dr. Nitin, Dr. Shailendra, me, and Dr. Savesh are the only ones who have done residency in both the old and new buildings, and we consider ourselves very fortunate to have seen the rich and humbling legacy of the past, as well as the pride and glory of the new. We had state-of-the-art, fully equipped ICUs. We had 3 modular state-of-the-art operation theaters, which were the first modular operation theaters in any government setup in Uttar Pradesh at that time, along with a dedicated sterilization and scrub station. Beautiful and spacious wards. Our OPD, which was shifted from the old OPD building to the present one. And this seminar hall, named after the founder, late Professor A. Charan. Professor S.K. Singh was the organizing secretary of the first National Cardiac Surgery Conference in Uttar Pradesh, which was held in this very hall, the midterm IACTS Techno College in 2013, with a cadaveric workshop on heart transplant. These are a few pictures from that occasion. Academically also, the graft kept on growing. In 1973, MS thoracic surgery was given permission to start with Professor K.N. Sinha sir being the first candidate. MS thoracic surgery was a degree awarded to the first to pass out from this department. Late Professor K.N. Sinha and late Dr. A. Dayal were the first to pass out who had obtained MS in thoracic surgery. Although there was one seat of MCH in TCVS, since 1973 the seat was not recognized by the MCI. The department worked hard to get this one seat recognized retrospectively in the year 2010. This was a great news for all the alumni passed out from this institute, as their degrees at that time were not recognized. Keeping with increased workload, permission in 2010 was taken for increased intake of MCH CTVS seats. Progressing further, 2 MCH seats became recognized from 2012 on, and we now have 2 MCH CTVS seats per year, 3 non-PG SR seats per year, and 11 non-PG JR seats per year. This is the list of our 37 alumni who have passed out. 2 of the senior most alumni are unfortunately not with us anymore. This is a photograph showing the thesis of our very senior alumni, Professor Vinay Krishna sir and Dr. Z.S. Mehrwal sir. Several new milestones were kept being achieved meanwhile. We were the first to start the use of a cell saver in 2013. First ECMO in UP was done in 2015 by Dr. S.K. Singh sir. First LVAT was also done in 2017 by Dr. S.K. Singh sir. In 2018, we were the first center in Lucknow to start surgery under Ayushman Bharat scheme. We were the first cardiac center in Lucknow to start surgery under Ayushman Bharat scheme. And now in the present day, our department stands proud and tall with a formidable workforce ready for the future. Coming down now to the annual report. Our faculty consists of 3 professors and 2 associate professors. We have 2 MCH SRs and we have got 12 non-PG JRs. We've got a formidable workforce with a lucky number of 101, including nurses, clerks, technicians, perfusionists, liftsmen, washermen, ward boys, etc. In 2024, our total OPD admissions were nearly 17,000 and total admissions were 787. We operated on 602 cases, maximum were valves followed by CABGs. We are grateful for the administration to have helped us out with our demands for new equipments, and we had 11 new state-of-the-art equipments added in 2024. We have published in many reputed national and international journals. Our highest impact factor has been 12.8. These are the list of publications by our faculty in 2024. Conferences, we attended a total of 22 conferences, 2 international and 20 national. We were examiners for AIMS, for JNU and DNB exams. There were 4 promotions this year, 2 from assistant to associate and 2 from additional to professor. Dr. Kumar Rahul was awarded the travel grant by the Japanese Surgical Society at Nagoya, Japan. We were also involved in various departmental activities. We hold regular public awareness sessions in the OPDs regarding anticoagulation and management of post-op patients, especially valve patients. We hold anticoagulation workshops. We celebrate World Heart Day. We hold regular updates. This is a picture of the sterilization updates for nurses in September last year. We hold regular departmental briefings and meetings nearly 1 or 2 Saturdays a month. We celebrate our birthdays, festivals, farewells, Vishwakarma Puja, national festivals, and our future vision is heart transplant, for which we already have the necessary permission and infrastructure and are all gearing up to it. Thank you so much. We now move on for the most cherished segment of today's gathering, the address by our esteemed Vice Chancellor Padam Shri Professor Sonia Nityanand ma'am. Under her dynamic leadership, the institute not only achieved the prestigious NAC A++ grade, soaring to the top ranks amongst the medical institutes in India, but also witnessed remarkable expansion on all fronts, being honored with the FICCI Healthcare Excellence Award. It is a matter of immense pride and distinction for KGMU, as ma'am has further elevated the prestige and honor of our esteemed institution by being conferred the illustrious Padam Shri Award. Her exemplary achievements and this distinguished recognition have adorned the legacy of KGMU with unparalleled glory, inspiring each of us to strive for excellence and greater heights. With utmost reverence and honor, I invite ma'am to grace us with her invaluable insights, profound guidance, and words of inspiration that shall undoubtedly propel our department to even greater pinnacles of excellence. I welcome ma'am to the stage.
Thank you, Dr. Teverson, for such beautiful words. I'm very honored and very humbled by it. All the dignitaries on the dais, the Dr. Vivek Teverson, who's the head of the department, Dr. S.K. Singh, and Dr. Bhupen, who's the organizing secretary, and of course, the most important are the orator of today, the Foundation Day orator, Dr. Meherwal, Dr. S.K. Sinha, the guest of honor, and Dr. Vijay Dikshit, who's also the guest of honor. All the esteemed faculty members from the department and from outside the department of KGMU. I can see the stalwarts of RML here also, Dr. Jain, Dr. D.K. Srivastav, Dr. Manisha is here, Dr. Abha is here, and all the esteemed alumni, KGMU alumni from the CVTS department. All the staff, nurses, staff of the department, a very warm welcome and congratulations to the entire department for the 66th Foundation Day. This day is an effort, team effort of all the staff. So I would like to congratulate all the staff, jitna bhi staff yahan par hai, for bringing the department to this stage. And a very, very nice report has been presented by Dr. Vivek Teverson. It's a very encouraging report, and the way you presented it also was very coherent and very nice. I have a special feeling for the department, emotional feeling. One, so many alumni are present here. From KGMU, who have been my seniors, some of them have been my teachers. Dr. Beharwal, who sits on the dais, he may not remember, I don't know, but he has operated my father for a bypass surgery in 2001, I think, January 2001, And I must say, I just want to add here that my father has lived till 99 years of age after this surgery. So this is the magic of a cardiac surgery, I would say. And when I went and I took him there, I soon realized, I was in SGPGI at that time, I soon realized that escorts, the system is such, it was actually very inspiring for me. The system of escorts is such that it takes care of the patient. And I actually felt redundant there. They have laid down standard operating protocols which will take care of the patient. So you don't have to struggle to take care of your relative. The system takes care of it. So he said, okay, since you have nothing to do, you come and join me for a few surgeries 2 days, because we'd gone there 2 days before. You come and watch a few cardiac bypass surgeries. So I was actually very thrilled. And I joined him and saw what was to be done on my father 2 days later. Of course, at that time, I was not allowed in the OT, So thank you, Dr. Meherwal, for that. I also would like to acknowledge, Dr. Vijay Dikshit and Dr. S.K. Sinha, who come from two giant corporate hospitals of the country, Apollo Hospital and the Max Super Speciality Hospital, respectively. Thank you for being there. I was sitting with Dr. S.K. Singh and recalling some of the memories that I had of the CVTS department in SGPGIMS. Dr. Abha Srivastav was there at that time, a young lady getting into cardiac surgery. It was a great inspiration for us who were junior than her. I also was doing a DM there at that time. It was such an inspiration for us for you to be there and doing an MCH in cardiac surgery. And the circle of life is full, and you're now back to, after Shri Chitra, you're back to Lucknow now, As Dr. Teverson has already brought out, the department has really come to the forefront of cardiac surgery, despite the limitations of very few and sometimes none MCH students. We all know that this is a new trend for various reasons, that very few students are joining the MCH program. And despite that, the department has done a voluminous number of surgeries, almost all types of surgeries. And Dr. S.K. Singh, who is my colleague in SGPGI, and a dear friend of mine from SGPGI, I would say. And in fact, when he joined KGMU, I used to feel, oh, SGPGI has lost one of the best cardiac surgeons. And now when I come to KGMU, I feel I'm very lucky that you're here in the department. So he has set up a number of these surgeries after, as we saw by what Dr. Teverson had presented, several new surgical procedures, which have now, of course, become routine surgeries in the department. But now the department has actually started on a new path. And that's why I'm so happy that Dr. Vijay Dikshit and Dr. S.K. Sinha are here, which is on cardiac transplantation. And Dr. S.K. Singh, of course, is trained in Australia for the same. I am personally interested in taking the transplant program of KGMU as a whole forward. So there is already here kidney transplant, liver transplant, trying to now establish in a full-blown manner bone marrow transplant, because that's my own field. But I'm also now, we've already had brainstormings, laid down a roadmap for starting a cardiac transplant program. So I think that will happen very soon. One of the road blocks was the referral of patients from cardiology department. And for that, Dr. S.K. Singh approached me, and we've started, I think, a joint clinic now with the cardiology department, where the cardiologists and cardiac surgeons come together under one roof to make treatment decisions in a patient, including the need for a cardiac transplant. So with this now going on fairly well, I think the department has inched forward now towards cardiac transplantation. And I do hope in this year, 2025, if not 2025, at least in 2026, the cardiac transplant program will take off. So all my good wishes to the department. It has young faculty with a lot of potential. I've had several departmental meetings with them. I've gone around their infrastructure, and I feel it's excellent. Each one of them is very dedicated, very sincere, very passionate about their work. So I'm sure the department will rise higher and higher. And I do hope in the year to come, more extramural projects are submitted and even more publications stem out of this very productive department. So my good wishes to all the staff. Thank you all for contributing to the growth and development of the department. Thank you. Jai Hind.
Thank you so much, ma'am. We are sincerely grateful for your invaluable pearls of wisdom, which have enlightened and inspired us all, and for your unwavering guidance and support and encouragement. May I now request our organizing chairman, Professor S.K. Singh sir, our organizing secretary, Dr. Bhupender, our guest of honor, Dr. Vijay Dikshit sir, Founders Day orator, Dr. Z.S. Mehrwal sir, and special guest, Dr. S.K. Sinha sir, to please come forward, and our POVC ma'am, respected POVC ma'am, Dr. Abjeet Kaur, to please come forward and honor and felicitate our Honorable Vice Chancellor Ma'am with a memento and shawl. Thank you so much, ma'am. Thank you so much, sir. May I now request the dignitaries to please sit on the dais. I request our Honorable Vice Chancellor Ma'am, Padam Shri Professor Sonia Nityanand Ma'am, our Pro Vice Chancellor Ma'am, Dr. Abjeet Kaur Ma'am, our Organizing Chairman, Dr. S.K. Singh Sir, to please come forward. I now request Dr. Vijay Dikshit Sir to please come forward. And I request the dignitaries to please felicitate our guest of honor, Dr. Vijay Dikshit Sir. I would now like to request our special guest, Dr. S.K. Sinha Sir, to kindly come forward and request all the dignitaries to felicitate Dr. S.K. Sinha Sir with a memento and shawl. Although Sir is not an alumnus from KGMU, he holds a special place with the alumni as he has been the mentor of 5 distinguished alumni from our department. All of them have become cardiac surgeons par excellence and are leaders in their own field. This includes Professor S.K. Singh Sir, Dr. Salman Siddiqui, Dr. Surya Mishra, Dr. Sanjay Pandey, and Dr. Santosh Kumar. Dr. Sinha currently serves as the Senior Director of CTVS at Max Super Specialty Hospital, Saket, a position he has held since 2018. Thank you so much, sir. I would now request our Honorable Vice Chancellor Ma'am, Pro Vice Chancellor Ma'am, our Organizing Chairperson, and dignitaries to please come forward. And I would request our Foundation Day orator, Dr. Z.S. Meherwal Sir, to please come forward. I request the dignitaries to felicitate Meherwal Sir with a memento and shawl. May I request the dignitaries to please be seated on the dais. Respected Vice Chancellor Ma'am, all dignitaries on and off the dais, seniors, alumni, friends from the media, colleagues, ladies and gentlemen. It is an honor and a privilege indeed to introduce a towering figure in the field of cardiovascular and thoracic surgery, Dr. Azilya Singh Meherwal, who has kindly consented to deliver the Foundation Day oration today. Dr. Meherwal currently serves as the chairman and head of adult cardiac surgery, heart transplantation, and VAD program at the prestigious Fortress Escorts Heart Institute, Delhi. With an exceptional career spanning more than 35 years, he has personally performed over 32,000 surgeries. He has been the past president of the prestigious Indian Association of Cardiovascular and Thoracic Surgeons. Dr. Meherwal earned his medical degrees at KGMU, and was a consultant cardiac surgeon at King's College Hospital, London. He was recognized by the Limca Book of Records in 2008 for performing a CABG on a 94-year-old gentleman, then the oldest patient to have undergone the surgery. He is a recipient of numerous accolades, including the esteemed President's Award for his invaluable contribution to cardiac surgery. He directs the DNB cardiothoracic program at Fortis Escorts, training many surgeons worldwide, and leads one of the top heart transplant and LVAD centers in India. Ladies and gentlemen, please join me in extending a warm welcome to Dr. Z.S. Meherwal sir, a visionary surgeon and leader in cardiac healthcare, for the Foundation Day oration. Thank you, sir. Apologies for the small delay. We'll soon be back.
Professor Nityanand, Vice Chancellor, KGMU, Professor Kaur, Pro Vice Chancellor, KGMU, Dr. Dikshit, Dr. Sinha, faculty of the Department of Cardiovascular Thoracic Surgery of KGMU, other faculty of KGMU, my friends, staff of the department, very good morning to you all. I think it's already afternoon. You know, I think today I'm having the same feeling which I had long back. You know, you always become not only emotional, you get a different feeling when you come to your parent institute. I'm sure all of you get this feeling. And at the outset, I'd like to thank Dr. S.K. Singh to organizing this CME and starting the Foundation Day program of the department. And I want to congratulate and thank the whole faculty of the department for taking this initiative. This certainly is a great initiative and would give us the opportunity to interact with each other and share our lot of views and thoughts. ये चल नहीं रही है आपकी. You'll have to bear with my throat. I have a little pharyngitis. You're next. You're next. Or are you back? Yeah. Back. Okay. Before I start the oration, I like to pay my tribute to two great teachers of the department. Professor Charan, who founded the unit of thoracic surgery long back, as you heard in the history. Professor Charan took that initiative when there were very few cardiovascular thoracic departments in the country. And at that time, he thought of starting a dedicated thoracic unit. I'd like to pay my tribute to Professor Sinha, a great teacher, a great surgeon, who was my mentor and who actually taught me the basics of cardiovascular and thoracic surgery. He was very dedicated and very hardworking, sincere doctor and a great human being. And I must say, I have not seen many surgeons of that caliber who, in circumstances which we had at that time in this department, could start an open heart surgical program. Just to give a little interesting fact, which not many of you might be remembering, though it has been mentioned in the history that the first open heart surgery was done in this department in '81. And at that time, I was a young intern. The department didn't have a blood gas analyzer. In fact, I was talking to Dr. Dikshit. He was the person who was involved in the first open heart surgery, and he probably won't remember. My first thoracic surgery, which I did, was a rib resection, which at that time was the commonest thoracic procedure, and he taught me that rib resection. So he was the person who was involved in the first open heart, and the blood gas analyzer probably wasn't working in the department. And the sample had to go to the Department of Nephrology on the other side in the medical department. And a volunteer was required to take that sample from the operation theater to the Department of Nephrology, get the analysis done and bring back to the theater. And I volunteered for that. And in reward, I was allowed to stay in the operation theater to watch the first open heart surgery. So I can say, you know, I was fortunate and lucky to see that first open heart surgery of the institute. And at that time, obviously, as an intern, you hardly know what the heart surgery is. And when the heart stopped, you know, I was just thinking, what's going to happen to the heart now? How would the heart beat again? But it was so exciting, so thrilling to see that closure of the atrial septal defect inside the right atrium. I said, you know, if I'm given a choice, I'd like to become a cardiac surgeon. And fortunately, I got the opportunity to become a cardiac surgeon. And again, why I was saying that it gives you a different feeling, I met a lot of staff from the department, and some of them actually were working at that time. And so they probably are the special invitees sitting there. And they all will remember how primitive that department was, and Professor Sinha had the courage to start the open heart surgical program at that moment. I would also like to thank Professor S.K. Singh, who joined the department after completing his MCH and training. And he again took the initiative of developing a state-of-the-art department, which is as good as any department in the country. And he started many procedures, which were probably the first in the state, and certainly brought this department to this level where every one of you can be proud of. When Professor Singh was talking to me about what I should speak to, I said, do you have any specific topic? And he said, I would like you to speak on the heart transplantation and what are the challenges in India, especially to start a heart transplant program. And I said, well, I'll be happy to speak on that because this is very, very close to my heart. And it's a very important part of our cardiac surgical programs. And why it is important? Because heart failure is a rapidly growing public health issue. And there is an estimated prevalence of 64 million of patients suffering from heart failure globally. We don't have very great statistics of the numbers in our country, but it is expected to affect 1% of the Indian population. And the current estimates about the incidence is from 1.3 to 23 million. But what is important that of this large heart failure population, about 10% suffer from advanced heart failure. And this is the relatively new publication looking at the incidence of heart failure worldwide. And if you look at the data from India, it is 0.7 to 1.5. Pointer कौन सा है यहाँ पर? ये वाला? So it is about 0.7 to 1.5. And when we talk about the advanced heart failure, because obviously the heart transplant is required in these patients, we, as we know, we classify these patients into 4 functional classes, NYHA, which we have been reading from the MBBS. So patients who are in functional class 4, or according to the ACC staging, patients who are in stage D are the patients who are in advanced heart failure. And these are the patients where one needs advanced treatment, and the mortality of these patients is very high. For example, in India, it's about 17.4% of patients will die in 1 year if they are in advanced heart failure. And the only 2 treatment options which we have for these patients are heart transplantation and left ventricular assist device. And orthotopic heart transplantation is considered the gold standard long-term treatment for these patients who do not respond to the optimum medical therapy and continue to remain symptomatic. And though the first heart transplant was performed way back in 1967 on 3rd of December in Cape Town in South Africa, in India it started much later. But even now the number of transplants are quite limited. If you look at this figure, there are about less than 6,000 transplants which are currently performed worldwide. And majority of these actually are performed in North America, and some of them or the rest are performed in Europe. The Asia contributes to a relatively small number of transplants as far as the total number of transplants are concerned. And again, in India, the number of transplants are quite limited. When I was working in London in King's College Hospital, I had a lot of interest in transplant. In fact, I had the interest in transplant even much before that, because I had visited a couple of centers in the US for transplant, and I really thought it's an area which we need to develop in our country. So when I was working in King's College Hospital, London, I used to visit this Harefield Hospital. Some of you might have visited or might be knowing about this hospital. At one point of time, though it's a very kind of a primitive building, but at one point of time, this hospital was doing one of the largest number of transplants in the world. And I used to visit this hospital when there used to be a transplant, which normally happens in the middle of the night. So I used to travel from London to Harefield Hospital to watch the transplant. But you know, when I was visiting this hospital, I used to think that when I go back to India, which was my plan because I never planned to stay outside India, to settle outside India, I said, I'm not even sure whether we will be able to start the transplant program in our country, because till that time, the transplant had not started in India. But interestingly, when I was doing this up and down to Harefield Hospital to watch the transplants, it was in the night of 2nd and 3rd, I watched a transplant, and next morning, when I picked up a paper, this was Asian Age, which used to cover the stories of India. I read that the first transplant has been performed in India in All India Institute of Medical Sciences. And I was so happy and so thrilled to see this news. I said, well, the transplant has started in India, and we certainly can have the option or can have the hope to continue this as the treatment for our patients. And this became possible when in 1994, on 8th of July, the Indian Parliament passed the law, which was the Transplantation of Human Organs Act. And after this act, the brain death was taken as one form of death, and it was legal to take out any organ from the body and transplant. But the progress of transplant in India for the next 15 years was very slow. Until about 2012, hardly 30 transplants had been performed. So, but in the last 10 years, there has been a significant increase in the number of transplant, in the number of transplant centers, and also in the number of transplant surgeons. As you can see, the numbers are increasing. In 2019 and 20, when there was COVID, obviously the numbers dipped, but after that again, the numbers are increasing. But this number is minuscule compared to the number of patients who actually need this therapy. So what are the challenges? So what are the challenges of transplant in India? And these challenges apply to whenever you want to start a program or you want to continue and pursue the program. And these challenges include challenges of donor, recipient, infrastructure.
Vice Chancellor ma'am had to depart due to pressing commitments. We extend our heartfelt gratitude to her for graciously taking time out of her demanding schedule and to be with us today. We will continue with the oration. Sorry for the interruptions.
Shall you continue? Okay, so the challenges of starting a heart transplant program and obviously continuing the program, obviously there are multiple challenges, and these include challenges of donor, recipient, infrastructure, trained manpower, cost, and other logistics. The donor challenges are an important part of the overall challenges of starting a heart transplant program and continuing the program. You know, unlike the liver transplant and the kidney transplant, where you can take an organ from a live donor, the heart transplant is from a cadaveric. It's a cadaveric transplant, which basically means that you can retrieve the heart, obviously, from a brain-dead patient. And though India has world's highest road traffic accident, but its organ donation rate is very low. And road accidents killed about 1.8 lakh people in India in 2024, and 66% of these fatalities involve individuals who are young, between 18 and 34, and a large number of these patients were actually the donors, could have been the donors, but the number of donations are quite small. And if you look at the organ donation rate, India's donation rate is less than 1 donor per million population, which is far behind developed countries like Spain. Spain has the largest organ donation rate of 48 per million, and way behind US, which has about 36 per million donations. So India has very small number of donors. And it is not only that the number of donations are less because they can't donate, but because there are a lot of challenges, which includes lack of awareness. There are a lot of cultural and religious beliefs, including beliefs about life after death, which create hesitation among the family. Family's refusal, even though donor might have pledged, you have to take the consent of the family, and family is reluctant to give a consent for donation. And in a small 2025 study, it was found that a significant factor for 60% of the respondents, they said they didn't donate because of the fact that they had a lot of other beliefs. And we also have a very weak disease donation system, and this is very important. And why it is important? Because if you would realize that most of these road traffic accidents would be admitted in government hospitals, in district hospitals, who will have the ICU, but they won't have a trained manpower. They won't have the concept of brain death. They won't have a committee to certify the brain death, and they would certainly not even look at the possibility of a patient donating the organs. And also, there is a cost to keep the donor fit till the organs have been retrieved from that donor. The lack of medical training is a very important aspect of this, because you need to have the trained manpower to certify the brain death, to identify the brain death and certify it, and we need to have a medical training of our ICU staff, including the neurosurgeons, neurologists, and the critical care guys who can identify the brain death and certify, and then obviously from there we start the discussion with the family. And interestingly, majority of these are admitted in government hospital, but most of the transplants are performed in the private hospitals. There are also some legal and ethical hurdles, and there are sometimes legal and ethical challenges. Though the legal process has become very, very straightforward now, after the brain death has been declared, it's a very straightforward process now. And in this very small study which looked at why the organ donation rates are low, it was found that there's a disparity between the brain death certification knowledge among Indian physicians who are involved in the organ donation. In many years back, the central government established this organization called the National Organ and Tissue Transplant Organization, or the NATO, under the Ministry of Health, which is housed in Delhi. And this organization is expected to oversee, coordinate, and regulate the process of organ donations. And North India, this is the body for allocation of the organs and to keep the data of the transplant which are happening in the country. And it maintains a registry, and it operates a 24/7 helpline. These are the numbers from the NATO, the National Organ and Tissue Transplant Organizations, of the number of deceased donors. In 2022 was one of the highest. It was 941, which resulted into 2,694 transplants from deceased donors. And out of these, the number of heart transplants were 243. So currently we do about 250 of transplants in the country, which, as I mentioned, is quite small, considering the requirement of the transplant. And about 144 of lung transplants were performed in 2022. So we not only have the challenges for donors, but also for the recipient. And there's a very common belief, which is true to a large extent, that there's a organ shortage. But many of these organ hearts actually go waste because of multiple reasons. An important challenge which we have realized and we face is the late referral for transplant. So I think this is a very important issue which is faced by any transplant center. When we are referred the patients, and this I've seen in the last 12 years in my practice when we started the transplant program, that a lot of patients are referred to us when they are already ineligible for transplant. Because obviously every patient will remain a transplant candidate up to a limit. Beyond that, patient may have multi-organ failure, or the pulmonary pressures and the PVR goes so high that the patient doesn't remain a transplant candidate. So timely referral is very important. And this is also interesting that a lot of times the patients, they also don't accept the transplant as a treatment option because they feel that they probably can pull through the life for a few years with the medications and other things. We have a very, the transplant has to be performed within a time frame when you are allotted an organ by the NOTO. And the recipient may be quite far, and a lot of times it may be difficult for the patient to travel to the transplant center because of the distance, and that may be challenging sometimes. So a lot of times our patients stay in and around Delhi, those who are very far, while they are waiting for the donor. But very interesting challenge which we have faced on few occasions, that when you get a heart and is allotted to you, you have a patient who is on a waiting list. You call the family and the patient that we have a heart, please come for the admission, for the transplant. And the patient or the family would say, sir, abhi to thoda theek lag raha hai, can we wait for some time? And the patient will refuse or the family will refuse. And unfortunately, for a large number of these patients, they never get a second chance. And they would die while they are waiting for the next organ to be available. The cost challenge, they will always remain a challenge in our country for any high-end therapy, and that applies to the transplant as well. And the cost of transplant in private hospitals may vary from 50 to 30 lakhs, and in addition to that, the patient obviously has to bear the cost of immunosuppressants for life, which can be significant. Many states, particularly in south of India, have started helping the transplant patients in terms of the finances, but this is not uniform in the country. So we certainly need the state government support. The central agencies, again, either they don't reimburse or pay, or they do a partial funding, so that again, so majority of the patients, they have to pay from their pocket when it comes to transplant. And again, the insurance certainly doesn't cover the transplant most of the time. A very important challenge is a transplant challenge, because we have a window period of about 4 to 5 hours, ideally 4 hours, when you have to retrieve the heart, transport the heart from the donor center to your center, and perform the transplant. Because there is a inverse relationship between the ischemic time and the survival of the patient after the transplant. So ischemic time basically means when you clamp the aorta, that means the coronary arteries blood supply stops. You retrieve the heart, preserve the heart, you transport the heart to the transplant center, and then when you perform the transplant, till that time, when the blood gets its supply from the recipient, that period is called the ischemic time, and this period ideally should be less than 4 hours. Because longer the period, the poorer the outcomes. And therefore, when you have long distance donors, you have to have a very good coordination to transport this heart either through the airlines and traffic, and you have to have very good coordination with multiple agencies. And considering these challenges in our country, even transporting the heart on the ground, either from the airport or from another hospital, if it is a distance which can be covered by the local transport, you have to have a mechanism by which you can transport the heart fast. And that's when the concept of green corridor came. And in fact, in Delhi NCR, we created the first green corridor when we did our first transplant. And fortunately, this donor was in our own network hospital in Gurgaon. So it was very easy to transport because this was local hospital, and we had to create a corridor, and this is where the police helps. This has become pretty normal now whenever there's a transplant anywhere in the country. One of the developments which has occurred in the transport and also in managing the donor heart is a system called organ care system, which has been developed by a company called Transmedics. And with this machine, as soon as you retrieve the heart, you cannulate the heart and you start perfusing this heart with the donor's blood, so heart continues to beat. You can continually assess the heart, and not only you can increase your transport time and the ischemic time, but you can also assess the marginal hearts, and lot of hearts which could have not been used can be used using this system. And using this system, the study has been conducted to see if we can use the marginal hearts, or we can use the so-called extended criteria for the donor heart. So this basically means that those hearts which probably could have been refused for one reason or the other, and the two important reasons being either that the travel time could have been more than 4 hours, or the heart has certain other abnormalities, including some coronary artery disease, borderline left ventricular function, or the age of the patient is higher. In these patients, the system helps you to assess the heart and transport the heart, and you can utilize the heart. Very briefly, we started our heart transplant program more than 10 years back at Fortis Escorts Heart Institute. And our first patient was a 16-year-old boy who was suffering from dilated cardiomyopathy. He was in advanced heart failure for many years. He was in our medical follow-up and on our transplant list. And when an organ became available, we transplanted this boy. And currently, he's leading a normal life. He completed his graduation, post-graduation. He got married. Now he has a kid and is leading a normal life, except that he got admitted twice in the last 2 years with the rejection. And actually, he had stopped his immunosuppressants on both the occasions. And fortunately, he responded to the medical treatment and didn't require anything beyond that. But we had to retrieve the heart from long distances many times, and that's when we had to use the air ambulances. But again, that adds a lot of cost to the patient, and many times we have actually transported the heart through commercial flights, which certainly is not the ideal way. But to decrease the cost, we have used the commercial flights to transport the heart many times. But the quality of life after transplant is excellent, and many of our patients, they actually participate in competitive sports, and some of our patients, they actually participate in the half marathon in Delhi. Just to mention that you need to have a program of the mechanical circulatory support also, because those patients who are not candidates for transplants or they can't get a heart, one can use a left ventricular assist device. And we started this program in 2015, and our first LVAD was performed on 4th of June in 2015. And he was a 74-year-old patient who at that time was one of the oldest patients to have received the LVAD. He was suffering from ischemic cardiomyopathy in class 4 symptoms. And obviously, he had multiple admissions, and we offered him the LVAD. So this patient celebrated his 84th birthday in US, because his daughter lives in US, and he is leading a normal life. In fact, he keeps traveling between India and US to meet his daughter. And just briefly to mention how to start, Sushil, the transplant program. And the most important thing is you need to have a very dedicated heart failure clinic. And it doesn't have to be a normal cardiology clinic. It has to be a dedicated heart failure clinic, and that's what we started. And we started the heart failure clinic exactly 2 years before we started the transplant program. Because you need to build your patient database. You need to develop the protocols and a lot of things. So you need to have a very dedicated heart failure clinic, which would be managed by a cardiologist who is interested in heart failure. Unfortunately, not many cardiologists would be interested in heart failure, because interventional cardiology certainly becomes more lucrative for most of the cardiologists. But if somebody has a passion for this particular area of heart treatment, then it certainly can be a viable option. So you need to have a heart failure clinic. So then you need to have a heart failure registry. So we started our registry many years back, I said 2 years before we started the transplant program. So you need to enter your patients. You have to review those patients on a regular basis. And then you also need to have a heart failure treatment pathway. So patients coming with symptoms of heart failure, you need to assess them properly. and see who are the patients who need either a transplant or an LVAD. Then you will assess. Once the patient becomes a candidate for transplant, you will list these patients on the NOTO website, because NOTO has to maintain the website, and the NOTO actually allots the heart as to where this heart is going to be allotted. So you will be uploading your patients on the NOTO website. And also you need to have the ECMO program and the mechanical circulatory support, because these patients will need or may need the mechanical circulatory support before, during, and after the transplant. And finally, it is also very important to realize that it is not only the cardiac surgeons who is actually the transplant, who can manage the transplant. It is a whole team of cardiac surgeons, heart failure cardiologists, anesthesiologists, transplant coordinators, perfusionists, infection control specialists, clinical immunologists, clinical psychologists, and nutritionists who are interested in this program. And we actually we sent practically one member of the team to a busy transplant and the LVAD center to train them in these transplant and the LVAD program before we started the program. And currently we have 2 members of each category, and we, whenever there's a transplant, we have one of those in theater or in the ICU, because you can't have a new anesthetist or a knee perfusionist for your transplant on an LVAD, so a dedicated team is very important. These are some of our members of our team who have been very dedicated, very sincere, very hardworking. So to summarize, to start a transplant program, an early referral of the patient is very important. We need to increase the organ donation. We need to have a national network of organ sharing. We need the support of the state government and the central government. For multiple reasons, a good infrastructure is mandatory, and trained manpower is very crucial to have a successful program. So with that, I thank you all for giving me this opportunity.
Thank you so much, sir.
It has been an honor to be part of this Foundation Day and to give this honor, to give this oration. And I can see a lot of my seniors, colleagues, and juniors sitting here, and we certainly will enjoy the evening today. Thank you very much.
Thank you so much, sir. As is the custom.
Normally in oration, I don't think we have a question answer, but if somebody has any questions, I think we don't necessarily have to keep it as an oration. We can have a question answer if people want to have that.
Thank you so much, sir. As is the custom, no questions will be asked after this honored oration. On behalf of all those present, I would like to extend our deepest appreciation to Dr. Z.S. Marwal, sir, for delivering a distinguished and enlightening Foundation Day oration today. We are honored to have benefit from your insights and experience, sir. Thank you so much, sir. We would now like Professor J.L. Sahani, sir, has just joined us, and we welcome Dr. Sahani, sir. I would like to welcome Dr. Sahani, sir, with a floral bouquet. Thank you so much, sir, for taking time out of your schedule and taking time out of your schedule and being able to join us today. Your presence means a lot to us. The felicitation ceremony for our esteemed Founders Day orator, the guest of honor, and the special guest was advanced to an earlier time. So, because this adjustment was necessary due to the Honorable Vice Chancellor Ma'am's other pressing engagements, which necessitated her early departure. I now would like to request Dr. S.K. Sinha, sir, to please come onto the dais. Sir is not an alumnus from KGMU, but has taught 5 of our alumni. Professor S.K. Singh, sir, Dr. Salman Siddiqui, Dr. Surya Mishra, Dr. Sanjay Pandey, and Dr. Santosh Kumar. The other significant contribution of sir to KGMU is that the first beating heart CABG in the whole state of Uttar Pradesh was done under his mentorship by Dr. S.K. Singh, sir, on the 21st of March 2002. Welcome, sir.
Thank you, Vivek. Dr. S.K. Singh, or Sushil, what I always call him. It's a great pleasure to be here for two reasons. One is that this department is headed by Dr. S.K. Singh, who has been with me for nearly 5 years in his initial period. And after that, we had a series of people coming from KGMC after their MCH to further hone their skills, or I can say that it was a finishing school, because after that, most of them went out and became heads in various private and government institutions all over. And I have been lucky because they all have been doing very well, whether it is him in the government sector or Dr. Pandey in the private sector in Batra Hospital. It gives me a lot of pleasure because I have seen them grow from a very raw person to a very advanced surgeons. And I can say most of them are better than me at present. The other thing is that my son has joined MCH in this place, and that also is a very rewarding thing for me, and that's why this day has been very special for me. Thank you so much.
Thank you so much, sir. We are honored to have you here. Now is the time to introduce our guest of honor for the 66th Foundation Day oration. For the 66th Foundation Day celebration, Dr. Vijay Dikshit, sir. Sir is a true luminary in the field of cardiovascular and thoracic surgery. Sir is the third pass out from this department after Professor K.N. Sinha and Dr. A. Dayal, and is currently the senior most alumni, having completed MCH in 1980. Sir first served as a lecturer in our department and also obtained a cardiac medical fellowship from the US in 1984. Dr. Dikshit has held several positions, including Assistant Medical Officer of Cardiac Surgery at Railway Hospital in Perambur and Consultant Cardiothoracic Surgeon at Apollo Hospital, Chennai. Since 1991, he has served as a Senior Consultant in Cardiothoracic Surgery at Apollo Hospital in Hyderabad, a testament to his enduring expertise and dedication. Dr. Dikshit has performed over 26,000 cardiac surgeries, a number that speaks volumes about his surgical skill and impact. His contributions have been recognized with prestigious honors, including the FIE National Award presented by late Dr. Manmohan Singh Ji in 1994, and an honor from the Ramakrishna Mission for his dedicated services. Dr. Vijay Dikshit is not just a surgeon, he is a pioneer, a mentor, and an inspiration. Please join me in extending a very warm welcome to Dr. Vijay Dikshit, sir.
Respected dignitaries on the dais and friends. "48 years back, when I decided to join this department, this was in infancy. It was the vision of Professor Charan, who always wanted a well-developed and advanced department of cardiac surgery, and his vision started this department. And I think this is the day, wherever he is today, he must be smiling and seeing the success which his successors have brought, and mainly Dr. S.K. Singh. He should be really applauded for the work he has done to bring up this department. Professor Charan always wanted, but unfortunately, he himself had a cardiac ailment and he could not do as much as he wanted to. And he always told me, go ahead, go and learn cardiac surgery and come back and start this center. I was reluctant in the beginning, but because of his pressure, I went to South, I went to Bombay, I went to South. I did learn cardiac surgery. I did come back. I did join here, but unfortunately, I could not continue for very long, various reasons. But we did our first, I'm very happy to say that we did the first open heart surgery in 1981, as Dr. Meherwal just said. Dr. Vinay Kumar, he was responsible for, he was the chief resident, he organized everything. Mr. S.K. Singh is, Mr. Singh is sitting there. Chaudhary is here. Chaudhary, Mr. Chaudhary. Yeah, they all were there. And S.B. Singh Saab was the perfusionist. And we all did that. I'm very happy to see them again here. So it is so wonderful to see your home department growing and developing like this. And I think all thanks to Sushil for bringing it up. Dr. Sushil worked with me initially many years back. Of course, I think it was which year was that? 1999. He worked for a very short time with me, but I tell you, I recognized his surgical skill even then. I remember I have a photograph. He has taken the vein graft. For the first time, somebody has taken the veins like he did. He made such small incisions, and I took that picture and I said, I have never seen anybody taking veins like that. And even in his early stages, early part of his career, he showed the surgical skills. I knew this man will be a very good surgeon, but I did not know that he will be such a good administrator also and bring up our home department to this level. Thank you, Sushil, and thank you all very much for calling me here and honoring me. Thank you.
Thank you so much, respected sir. It must have been nostalgic for you to see so many of your juniors carrying out the legacy which was set by pioneers like you. Thank you so much. Now we come to one of the most awaited time, the alumni roll call. There have been a total of 37 pass outs, out of which Professor K.N. Sinha and Dr. A. Dayal are unfortunately not with us anymore. But out of the remaining 35 alumni, it is indeed overwhelming and heartening to have with us more than 22 of our precious alumni. We are thankful to Dr. S.K. Singh sir, without whose efforts such a huge number would not have been able to be gathered. Thank you so much for taking time out of your busy and hectic schedules, covering miles, and gracing and blessing us by your precious presence. I would now request our respected and dynamic Pro-Vice Chancellor ma'am, Dr. Abhijit Kaur ma'am, to please come forward for the alumni roll call. And we will be calling out the alumni one by one. So I start the roll call with our senior most alumni, Dr. Vijay Dikshit sir. Thank you so much, sir. Our next alumni, Professor Vinay Krishna, sir. Thank you so much, sir, for coming and honoring us by your presence. Next, I call up on the stage Dr. Z.S. Meherwal, sir. Thank you, sir. Thank you, ma'am. Next, Dr. Manoj Asthana, sir. Thank you, sir, for taking time out and coming here. Our next alumni is Dr. Saeed Akhtar, sir. Thank you so much, sir. So good to have you with us today. Our next alumni, Dr. Sanjay Gupta, sir. Dr. Sanjay. He could not come. Our next alumni is Dr. Arun Kumar Goyal, sir. Thank you, sir. Then we have our mentor and our teacher, Professor S.K. Singh, sir. Next, I would like to call upon Dr. Jagmohan Singh, sir. Our next alumni, he was taking time out to come, Dr. Sanjay Kumar Pandey, sir. Thank you so much, sir, for taking time out and for your efforts to come and grace this occasion. Thank you, sir. Professor Anshuman Darbari, sir. Thank you, sir, for joining us today. Thank you, sir. I would like to call upon Professor Ambrish Kumar, sir. Thank you, sir. Next, I like to call upon Dr. Nitin Kumar Rajput, sir. Thank you for taking time out of your extremely hectic schedule and coming and making it. Thank you so much, sir. Next, Professor Shailendra Kumar, sir. Next is myself. Next is Dr. Sarvesh Kumar. Next, Dr. Vaibhav Jain. Then my junior, Dr. Kumar Rahul. Then my colleague, Dr. Bhupendra Kumar. Thank you, ma'am. Then we have Dr. Ajay Kumar Pandey. Thank you. Last but not least, I call upon Dr. Muhammad Zishan Hakim, our youngest alumni. Thank you so much. One of the most important, memorable, and cherished event, which is a once-in-a-lifetime opportunity for all of us alumni, is the group photograph, for which I request all the alumni to please come forward on the stage for a group photograph with the dignitaries. Um, Thank you so much, everybody. Our respected Pro Vice Chancellor, ma'am, Professor Abjit Kaur, ma'am, thank you so much for graciously standing with us in unwavering support, which means a lot to us. Our respected Pro Vice Chancellor, ma'am, thank you so much for graciously standing with us on the dais. Your patience and unwavering support in this ceremony mean a lot to us, and your presence has truly elevated the significance of this event as we humbly request you to please felicitate our junior doctors. To please felicitate our junior doctors and employees with the much awaited appreciation award. I request our respected Pro Vice Chancellor, ma'am, Professor Abjit Kaur, to please grace us by coming forward on the dais for the much awaited appreciation awards. So now I would like to call upon the junior doctors and employees one by one to come on stage and receive their certificates of appreciation. I would start with our SR and our junior doctors. So I would call Dr. Anklesh Sinha, who is Senior Resident 2, for the Appreciation Award. Thank you, ma'am. Now I call upon our non-PG junior resident, Dr. Swati. Thank you so much, ma'am. Dr. KG Gokul Raj is not here, but he is also getting a reward. There was some unfortunate event at his home place. Coming down to the employees, I call upon Mr. Manoj Kumar Shivastav, a senior technician. Then I would call Mr. M.I. Siddiqui, senior technician. Next, I call upon Mrs. Vibha Singh, who is ANS and in charge of our OT. Next, I'll call Mrs. Alka Verma, who is an ANS and in charge of the ICU. Next to come is Mrs. Neetu Singh, ANS and in charge of the ward. Our very senior staff, Mrs. Indu Rai. Next, another senior staff who has stood by us, Mrs. Asifa Bano. Also call upon another senior staff, Mrs. Rinku Verma. I'd like to call Miss Manisha. Miss Manisha. Next, I call Mrs. Deepmala Kanojia. Mrs. Rita Chaurasia. Mr. Muhammad Arif, Sikh attendant, has been with us since a long time. Mr. Muhammad Arif. Mr. Fakir Muhammad, Sikh attendant. Our employees have been our pillars and one of the strengths of our department, and we are grateful to them. Mr. Ramakant. Mr. Ramakant is here, but he is downstairs at the reception. He'll be coming soon. Mrs. Sadhana Sonkar. Sadhana is also here, but not at present in the hall. Mrs. Seema Maurya. Thank you so much, ma'am. Mr. Abdul Mannan, lift operator. Thank you, ma'am. Mr. Vijay Kumar, supervisor. Thank you, ma'am. Our young and dynamic OT technician, Piyush Shukla. Thank you, ma'am. Mr. Ranvijay Singh. I think he slept off, Ranvijay Singh. Thank you so much, ma'am. Narendra Mishra, our clerk, is not with us because unfortunately his mother passed away just 5 days ago. And last one is Mr. Sumit Sonkar, who is a clerk, who is presently in the office. Thank you so much, respected Pro Vice Chancellor ma'am, for your patience to be with us this long, making this event memorable. I now would like to hand the stage over to Dr. Bimal.
Thank you so much, sir. Ladies and gentlemen, we are truly privileged to be guided by our visionary leader with deep respect. I invite our Vice Chancellor ma'am, Dr. Abjeet Kaur, to kindly address this august gathering with her words of wisdom.
Good afternoon to each and every person here on the dais, my very senior, respected family members, I would say, from the eyes of my husband. And in the audience, so many of my friends. Actually, if you really ask me what I want to say, I am a little confused. Because the last 2 hours has been so mesmerizing, I have gone through periods where there was total lull in my mind. I didn't have any thought because there were so many thoughts and I did not know which one to prioritize. I would start by saying that a foundation day is actually a time when we look back at the givings and sacrifices of all those who laid the foundation. That would include not only the visionaries who are always remembered for the drawing plans that they made on the drawing board, but also all those staff members who were the initial ones who struggled in the wards and struggled in the OTs. Today, when I see such a plethora of people whom Dr. S.K. Singh has been able to gather, I truly say that CVTS सच में एक दिल का विभाग है. एक दिल जो इमोशंस से धड़कता है और एक दिल जिसमें बहुत ऊंचा उठने की चाह है. So Dr. S.K. Singh, I think the onus of carrying the burden of a rising department has very well been handled by you. Kudos to all the seniors and kudos to you and your junior team who are there in today's day and date. On a personal note, I have had the good fortune of knowing Dr. Charan through my husband's eyes. And the one thing which he always mentioned about Professor Charan was his discipline. I was just sharing with Dr. Dikshit that during one of the rounds in the evening, Dr. Chabra needed to go for a dinner. So he dressed in his tweed coat and came for the evening round. Dr. Charan was there in the ward. और दूर से ही देख के बोले, I don't like my boys wearing newspapers. So Dr. Chabra had to leave the ward, go back, remove his blazer or coat, whatever it was, wear his apron and come back to the ward. So that was a sense of discipline. And for anything to grow, we can't let it go haywire. Anything which has to reach vertically up has to be pruned and trailed to go up. Otherwise क्या होता है? वो horizontal growth फैलती रहती है. Undergrowth बनती रहती है. उस चीज को रोकने के लिए as an institution, as a department, discipline is something which has to be inculcated first at the personal level, then with your colleagues, then in the rest of the arenas that you work in. Your department, by flourishing, surely proves that it's an excellent department with a lot of discipline. Congratulations. I must acknowledge the warmth with which Dr. Dikshit made me his guest in Hyderabad, in his home, for nearly 3 days. I must acknowledge Dr. Meherwal for being a very strict senior resident to all of us, and so many others. My friend Manisha is here, Professor Abha is here. It's really lovely to be here today. Thank you so much. God bless all of you.
Thank you, ma'am, for your speech, and your presence has truly added grace and meaning to this session. I would like to humbly request our dignitaries to felicitate Dr. Abjeet Kaur, ma'am, with the memento and shawl. Thank you so much, ma'am. Every memorable occasion deserves a graceful conclusion. To formally express our gratitude to all who made the today's event a success, it is now time for the vote of thanks. I invite Dr. Kumar Rahul sir, Associate Professor in Department of CTVS, to kindly come forward and deliver the vote of thanks to this august gathering.
Good afternoon, everybody. It's an honor and a pride privilege for me to deliver the vote of thanks, which marks the 66th Foundation Day of our department. 66 years ago, few visionaries dared to open the human heart and started the journey which we still are continuing today. On behalf of the organizing team, I would like to extend our deepest gratitude to our chief guest, our special guest, and guest of honor. I would also like to sincerely thank our orators for their presence and inspiring and valuable words. To our distinguished alumni who have traveled from far and near, welcome home. I would also like to thank all the alumni who could not attend. Your achievement across the globe shall keep the banner of our department flying high. A special thanks to the organizing committee, staff members, volunteers, media members for flawless planning for making this event possible. And of course, heartfelt thanks to our wonderful audience for your time and support. Let us carry forward the same pioneering spirit that marked our founder's first surgery 66 years ago, and to keep the heart of this department beating stronger and stronger. Thank you, Minister.
Thank you so much, sir, for adding grace to the ceremony. May I kindly request everyone present here to rise for national anthem, the melody of our unity and pride.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंग विंध्य हिमाचल यमुना गंगा उज्ज्वल जलधि तरंग तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
We would now like to invite our respected dignitaries and all the guests to kindly proceed for lunch. We are grateful for your gracious presence and hope you enjoy the meal and fellowship. After having lunch, kindly gather again in this hall to resume the remaining academic session with the most awaited part of alumni get together and reminiscing the past memories.